started whenever.
Good, excellent. Thanks, Amy. So bye, everybody. Welcome to Amy too. She's filling in our group now for a little while. So that's great. Thanks, Amy. Appreciate it. So everybody, let me just say about questions. So those of you who've heard me talk before, and I'm sure some of you have, I feel like I've been here a lot lately, by the way, will know that I have no problem with you unmuting yourself at any point to ask a question. Don't worry about cutting me off. That won't bother me. Or put it in the chat. I've got it down in the bottom of my screen here. So I try to keep an eye on it as we go. I'm not always perfect at it, but I do try. So feel free to jump in anytime. I'm okay with that. And we should have a little bit of time at the end too, I think, for questions. So perfect. Okay. So here's what I want to do today. So as you know, we've just had our quantitative series last month, or some of you will know, because I've recognized some of the names who were registered from last month as well. So thank you for your interest. This month, we're moving now into qualitative research. And so my job is just to give us a bit of an overview, really hard to do, just like the quantitative, because there's so many different designs and so many things to talk about. So I'm going to try to give you a bit of just an overview of some sort of qualitative research features, let you have I hope by the end of the day, have some understanding about how we undertake qualitative research, what are some of the methods we might use, and a little bit of talk about the collection and analysis of data, which is always a tough one. I hope I'll have time to show you just a couple of slides of data. So what are we talking about? What is qualitative research? So in its simplest sense, it's research that relies on the collection of non-numeric data, right? Such as words or pictures. We're generally not dealing with numbers here. But it seeks to understand a given research question or topic or problem very much from the perspective of the local population it involves, that population that it involves. Because of that in particular, I think, it can be really effective in getting that kind of culturally specific information about whatever it is, the values, the opinions, the attitudes, the perspectives, the behaviors of particular populations. So it does have that, yeah. Sorry, was someone talking, or maybe someone just needs to mute? I can't tell. No? Okay, I don't hear a question, so I'll assume it's a mute thing. Isn't that going to be the tagline of our lives now, by the way? You're on mute, or you forgot to mute, something like that, right? Okay, so I think qualitative research, the real strength is that it gives us these very complex textual descriptions of how people experience whatever it is we're studying, a given research issues. There are many different types of qualitative research, and I'll show you a bit of a list here now shortly, but all of them are concerned with answering questions that start usually or begin with, why, how, in what way? And I just want to tell you quickly, I'm actually a quantitatively trained researcher. I taught stats for 5 years in the psych department. I was the lab instructor for all stats courses. So my background is actually quantitative. When I was doing my PhD, and I'm going to tell you this now because I'm going to use this example as I go throughout, I came across an article about Huntington disease, which is a fatal neurological genetic disorder, quite awful. And I remember being fascinated by the question of, my God, like, how do people live, I wonder, with that risk, with knowing you carry a particular genetic alteration that gives you this risk. If you choose to be tested, you'll know for sure, yes, you're going to go on to develop this very awful disease, or no, you won't. So I was fascinated with that question. How do people live with that, I wonder? In what ways does that impact their lives? Would you choose? I was just starting a PhD, and I thought, well, would I do a PhD if I knew I carried that mutation and would probably die by the time I was 45 or 50? Would I do it? So I was fascinated by that question, okay? So how would that affect people's lives? In what way does that affect them? And that was my introduction into qualitative research. And so I realized to answer that question, I couldn't think of a quantitative design. I just couldn't, even though I was a quantitative researcher, right? So I had to begin to learn qualitative research. So I don't claim to be an expert, but I've learned a lot over the years, and I'll come back to that study now many times. So these next two slides, there's only 2 slides, but there's a lot on these 2 slides. And I'm going to spend a little bit of time going through these because I think it's important. They're getting at what the key features are, whatever the type of qualitative research. What are some key features of the design and some key features of, I think it's the analysis? Yes. So let's start with design. And I'll probably use my PhD research here often now as I talk about some of this stuff. So qualitative research is a naturalistic form of inquiry. We are not manipulating anything. We're not randomizing anyone anywhere. We're not exposing them to some intervention. We're studying real world situations, right, as they unfold naturally. It is non-manipulative and non-controlling. So it's very much marked by this naturalistic inquiry. And I'll give you an example of this next one, what I mean by it, emergent design flexibility. Lovely phrase, right? But what does that mean? So it's open to adapting the inquiry as you learn more, as understanding deepens, or as the situation changes, and you can pursue new paths of discovery as they emerge. Again, lovely. But let me give you an example. So when I began to interview people who had tested positive for this genetic alteration that causes Huntington disease, so they had tested positive. They were currently, many of them were currently asymptomatic. They weren't showing any symptoms, but they knew they would. And so I remember talking to a gentleman from rural Newfoundland, lovely man. I had a wonderful interview with him. And he shared with me, all of his thoughts about carrying this mutation, talked about how hard it was for him and for his children and so on. And right at the end of the interview, he says to me, "Now, are you going to talk to my wife?" I said, I never thought about that. Why? Do you think I should? What do you mean? He said, well, my wife is really impacted as well. Not in the same way I am. She doesn't carry this mutation, but her story is just as important as mine. It's different, but it's just as important. So I want you to understand where I was coming from. And qualitative researchers do a better job, in my opinion, than quantitative researchers in doing what I'm about to say. We're reflexive. We think about, how does my own training and background and my life experience impact the questions I'm choosing to do as a researcher, how I'm studying them. So what I realized when he said that to me was, oh, wait a second. So I did a psychology degree, and a lot of psychology is focused on the individual level of behavior. So I was reading all about risk and risk perception. And a lot of psychology theory is very much about risk and the impact of risk perception on our behaviors. So I realized it never occurred to me. I mean, by definition, a genetic disorder is a family disorder, right? Of course. But because my training and my reading and my thinking was all very focused on how do people interpret this risk? How do they live with this risk? I was focused on the people who were living with the risk, not their husbands or wives or other relevant partners. So it just never occurred to me. But because I had a qualitative design, when he said that to me, I was able to go, good idea. So I went back to the literature. I did a little bit of reading on, caregivers and partners in Huntington's. And what I discovered was they are an understudied group. They're often left out. And so I did eventually go back. I went back to ethics. I got did an amendment. And then I was able to interview 6 or 7 of those partners. And it became a separate publication. So they really did have things to say, which was very important. So I hope that helps to illustrate that emergent design. Much like the next one, purposeful or purposive sampling. We're not worried about generalizing to a population like we might do, for example, if we were doing a survey and we took a random sample, hoping to generalize to the population. Here, that's not what we're doing. Here, we're simply trying to get the most insight we can about a phenomenon. So the people, or the cases for study, as we call them, are selected because they're information rich, right? So they usually share experiences. So we might want to know about living with a genetic disorder, being an IV drug user, being a person with diabetes, and so on and so forth. So we're not worried about generalizing. We're more worried about making sure that we have a good representation, rich contextual information from that sample, which is a bit different from quantitative research. So how are we doing? Any questions so far, everyone? Does that make sense? I've heard a couple of sounds. I don't know, it might just be a mute thing, but I'll just pause for 1 sec to see if anyone has any thoughts so far. I hope you're not too confused already. No? Good. Okay, so let's move on to analysis. So again, just keeping in mind, whatever the type of qualitative research, good, Marianne, thank you. Here are some key features of the analysis. Okay, this idea of unique case orientation. So it assumes, qualitative analysis will assume that every case is unique and special. Now, what do I mean by case? Often, but not always, but often we're referring to a transcript, and we'll come to that now shortly about methods, but we're often doing a qualitative interview or we're doing a focus group. So when I say case, I'm often talking about an interview we've done with a person. The first level of analysis will really spend time on that first transcript. You really spend your time capturing the full detail of it, coding it, writing down your initial thoughts. You might do a summary page of it, and you don't move on to the next one, or comparing those transcripts or those cross-case analysis really does follow from and depends on the quality of each case. So it really does take time to read through those transcripts. And it's a bit different when you think about, say, a quantitative research. So again, say if we are getting a data set, we have a cohort of people, we're getting a data set, or we're doing a survey. We never analyze half of our survey data, right? We wait till we have it all before we do that final analysis. It's a bit different in qualitative research. Analysis and data collection are often happening at the same time. And the analysis is very inductive. So you really are immersing yourself in the data to discover those important themes and variables and relationships. So you begin by exploring your data. What do I have here? And hopefully we'll have time to look at a couple of slides of data at the end here. You'll see what I mean, with some sort of high level thoughts first. Okay, what do I see? And then as you move forward in your transcripts and you keep reading and reading and reading, you begin to confirm your ideas, right? People often say to me, well, how do I know if I'm coding it right? And I always say, well, you certainly don't. The first few, how can you? You only have a first few. There's 2 or 3 people's experiences, right? So you do need that data set before you can sort of creatively synthesize it. And as I said, this idea of data or theoretical saturation. So analysis is iterative. You are cycling between collecting data, reading your transcripts, analyzing, coming up with your concept. That will continue until no new information emerges from your interviews or your focus groups or whatever it is you're working with that either challenges or changes or elaborates your kind of analysis, what you're coming up with, the themes you're finding. What I have found in practice, there's no one set number. People say, well, how many interviews do I have to do? How many focus groups should I do? I don't really have a quick answer to that. I've seen some different rules of thumb. Some of them say, go an extra 2 or 3 interviews after you feel you've reached saturation. So for me, that has often been 16, 17 interviews. I feel like, yeah, okay, I'm hearing the same things come up. I'm not really seeing anything new. I'll always go 2 or 3 above that just to be sure. Okay, so that is sort of a key feature of qualitative analysis as well. So those are 2 sort of things to keep in mind. So sort of key features of the design, the strategy, and of the analysis. Now, here's the other question I've gotten many times over the years. Which is better, quantitative or qualitative? I can tell you, when I was a PhD student, fully quantitatively trained, I knew nothing about qualitative research. I took an advanced qualitative methods class, and I was the only person in the room who did quantitative research and liked it. I also like quantitative research. And as a result, I was challenged a lot. And I asked a lot of questions in that class, which were not welcomed sometimes, because I would say, well, that doesn't make sense to me. In quantitative research, we do this. So I had a lot to learn. But what I really learned that semester, and I've carried it with me ever since, I actually think that pitting qualitative versus quantitative against one another is simplistic and unhelpful, quite frankly, in my opinion. But I've had this asked a lot over the years, and I've had a lot of people who don't understand qualitative research down it because they lack understanding about it. So whenever I have a chance to talk, and you see, this is my soapbox, I'm doing it now, I actually don't think either of these are better. I think the real question is which approach is better suited to your question, to what you want to study. So I've done a lot of quantitative research, but when I wanted to find out how people live with a fatal genetic risk and how that impacted their lives, I needed a qualitative approach, and it worked really well. So I just want to make that point. I actually don't think one is better than the other. I think it's really important to think carefully about your question, right? And which one might work for you. So I will say this as well. You know how when we talk about, for example, quantitative research, we talk about, randomized control trials, case control studies, whatever, cohort designs. It's much the same in qualitative research in that there are different types of it. There are many differences. There are differences among them. So I know I just said, for example, that they share key features, and they do share those key features. But there are some differences among them. These are often, not always, but often driven by philosophical considerations. And I can absolutely assure you, as a student, and I will get to your question just one sec because it's related. I was thoroughly confused. I had never heard the word epistemology or ontology. I'm still not entirely sure I understand them really well, but we're getting at theories of knowledge, theories of truth. What do I believe is reality? Is it out there and real, then I can measure it, it's objective, or is it socially constructed? So many of the differences among these types are very philosophical. Don't get lost in that. Don't get lost in that. So Asma, I will include some references for you. Yes, I will do that. I haven't done it in here, but I will, first of all, feel free to email me directly and I'll shoot you off some. And I'm also happy to email them back to Newfoundland Support, and we'll get them that way. But email me directly. I'll definitely send you some references for sure. One off the top of my head I'm going to tell you is David Silverman. David Silverman, he was an author way back when I was doing my work, and he writes for students really well. It just explains things really well, and he's funny. He was really excellent. So email me directly. I will definitely give you some references. The BNJ also has a few articles that are very concise and easy to read as well. So look at this here, everyone. Here is a list. This is not exhaustive. I'm sure there's tons more. These are just some types that you may hear about. So, for example, ethnography, social constructionists, phenomenology, critical theory. This was being seen more and more when I was doing my PhD, which was back in 2005 now, by the way. Feminism, grounded theory, discourse analysis, conversation analysis, and so on. So all these different types. And I will tell you, if you're new to this and you're trying to figure out, well, what approach should I take and so on, there are literally reams of library shelves filled with books on each one of these. So today we're just trying to give you a really brief overview. I just want to recognize there's a ton I'm not saying, and quite frankly, don't know about a lot of these types, right? Because I haven't used them myself. I just want you to understand that there are many different types. Some qualitative research is descriptive. So its goals and assumptions are generally not driven by really strong, anyway, philosophical considerations, but much more by the research question itself or practical considerations. Most of my work falls here, by the way. I'm really very practical. I'm an applied health services researcher. I often want to inform some very specific thing on the ground in a healthcare setting. And again, I'll show you an example of that now shortly. And next week, I think it is, Rebecca will be talking about a descriptive, qualitative description, interpretive description in particular. I'm a little bit bummed because I'm in a 5-hour graduate admissions review meeting, so I will miss it. I'll have to listen it later, but listen in if you want to learn a bit more about that, because it's a well-used sort of approach. And thanks, Amy. Yes, that's exactly how to reach me, everyone. Email, I'm very quick on email, so do that. So here's what I want to do.
A question, just a question. I have done a little bit, not for a while, qualitative research, but I've done the qualitative, and you're probably going to get to this, but qualitative research is really powerful when it's combined with your quantitative. So, and it sheds additional light and gives nuance to I find it's very good. And so you can combine the two and get better insight into the quantitative data you're getting, which I hope we can do with Rosemary and our long-term care project to get some of the quantitative measures of health that can,
100%. Yeah.
right, that, and then you've got the qualitative, what people are saying, to give you a better picture of what's really going on.
100%, Chris, you'll know, you've probably heard me talk about this before. So no, I'm glad you raised it, because I'm actually not going to get into a whole lot of that today, only because I'm just trying to focus on the qualitative. But you're absolutely right. We know, for example, in patient engagement, we have standardized surveys that are given out now across the country. I don't know what we do here in Newfoundland exactly, but many of the hospitals now have standardized patient experience measures. And I've seen, and I teach it in the patient engagement course, the same patient, when they fill out the scale, you know, oh, how was your care? Oh, it was excellent. And then they're given a qualitative interview, and you see the nuance in the interview of this lady who says, well, they're all really great and they really care, but you know, if I need a bedpan, I need one now. That could be quicker, things could be less embarrassing, and blah, blah, blah. So yeah, you're absolutely right, is an excellent point. When you have the opportunity to have both, I don't know that that's ever been a bad thing, right? So I agree. Yeah, 100%. Thanks, Chris, 100%. So everyone, I'm just going to very quickly take a couple of slides to go into a little bit more detail about these three types. So we just had the big list, right, of the qualitative designs. There are more than that. Just a little high level thought about these three. I don't want to say too much. Certainly the grounded theory, Dr. April Pike will be coming in to talk about that in a couple of weeks' time. So I don't want to say too much, but just want to give you a sense of a flavor of these differences. So phenomenology. That's one of the types or approaches to qualitative research. What do we mean by this? What are we talking about? So we're surrounded by phenomena, of course, but may not always fully understand them. So this approach begins by acknowledging or recognizing, you know, there's some gap, there's something we don't understand in whatever the topic is or the issue is, and clarification would be of benefit. So take, for example, we know a lot of people are carers, right, or caregivers. But what does that mean? Well, you know, what is it like to be a caregiver? Think about back pain. We could do a randomized controlled trial, and we could find out, you know, does drug A work better than drug B at controlling low back pain? But what is it like to live with chronic back pain? What is that subjective experience of chronic back pain? So literally, phenomenology is the study of phenomena, those events or situations, concepts, experiences. And see this here in capital life world, it really is concerned and focused on the life world of experience as lived by participants. And when I teach graduate students, I always say to them, so now everyone, this would be a good multiple choice question. Life world really is sort of a phrase that belongs to phenomenology, for example. So because it's concerned with that life world of experience as participants live it, it really does focus on people's subjective experiences and interpretations of the world. And so that might not provide perfect, definitive causal explanations, but it certainly does raise awareness and increase insight, and might be important in patient care and health service provision. I'll give you an example of that from my work. So my doctoral work took a slightly modified version of phenomenology called interpretive phenomenological analysis, or IPA, and it worked very well for my purpose. And one of the things I found very, very clearly, and it's borne out really well in the literature, is that people do have a very subjective interpretation and understanding of their own risk that may or may not be correct factually. And many of them know my risk is 50-50. They know their correct objective risk. But then they'll very quickly say to me, but I know mine is higher because I'm just like dad. Or I know mine is higher because all of the women in our family were affected with whatever, ovarian cancer, breast cancer, et cetera. And that subjective lived experience of their risk, that is what determines what they do in their life, choices they make, whether or not they have children, whether or not they engage in screening, relationships with their partner. So that idea of focusing on the life world of their experience as people live it really can be important. So if I'm a genetic counselor or some other genetics healthcare provider, it might be important for me to know that many people are interpreting their risk in that way, for example. So that's phenomenology. That's one of them. Ethnography, let's talk about this one. Now, I've never done any ethnographic research, okay? So I certainly can't speak to any personal experience, but this is often used in anthropology, by the way. This is certainly where I've seen it most often. It is looking at, again, so remember we said, all of these qualitative methods are very naturalistic. Well, ethnography most certainly is. Often it's called naturalistic research, in fact, sometimes. And it is a method of talking about a culture or a society. So thinking about a system of shared beliefs, values, practices, norms, how we understand our world, like group members. And so it's often a very labor-intensive and time-intensive method, because the researcher often goes into the culture and spends time within the setting. I once heard a really interesting talk from someone who had spent time with the IRA in Ireland and did an ethnography of the IRA. I never did read it, but I suspect it will be really fascinating. It will take what we call an emic perspective, so the insider's perspective, and will use emic terms. Expose them, specialized words that are used by people in a group. Now, if we think about, say, healthcare research, why that might matter or how that might be important, well, we know that cultural norms and rules can certainly affect a population's response to care or screening or treatment. So we know, for example, there's some good literature suggesting that cultural rules about contact between men and women, for example, have in fact affected cervical screening rates in some Mexican and some Asian cultures. So this kind of gives you a sense of why really having that cultural understanding and deep immersion in the culture can matter. But they really are time consuming. I have great respect for people who do this kind of work. Time consuming and really do entail extensive field work. And the method is often participant observation. So they are there in the culture observing. And that final ethnography or report should really provide a very rich and fulsome, holistic description of that culture or the group under study. Now, another one, grounded theory. This might be the one most people will be most familiar with, I would think, or probably have heard of at least the most. So again, I've never done a grounded theory study, so I can't speak to personal experience. I think these can also be quite time consuming. But one of the key, and I don't want to say too much about this because I know April will be having a session focused on grounded theory. So I encourage you to have a listen to that one as well. But the main feature here is you're actually developing theory, which I haven't talked about yet, right, in the other ones. So you are developing inductive bottom-up theory that is grounded, that's why we call it grounded theory, directly in your data. So what emerges out of a grounded theory piece of work, the explanations, the ideas, the interpretations really are new knowledge and are used to derive theories about a phenomenon. The classic example, and where this came from, by the way, was from the grieving process. So we've all heard, right, I'm sure, of the 5 stages of grief. Well, that actually was a grounded theory study. I don't know if you knew that or not, about the interactions between healthcare professionals and dying patients. And so when that first came out at the time, and it seems like we've known about that forever, right? Denial and bargaining, right, leading to acceptance. But that actually was a grounded theory study. So, practitioners would use that to understand the process of bereavement, to help people come to terms with their loss. But because it's a theory and these stages are laid out, you can recognize, right, when someone may be having additional difficulty because they aren't going through the process, if you will. So the knowledge derived from that grounded theory study has been used to recognize signs of abnormal grief. And then practitioners can intervene. So I think that's a really cool feature of grounded theory. I will say this, again, this is getting back to my multiple choice while I was kid students about it. So data analysis often will follow 3 steps in grounded theory: open, axial, and selective coding. And I always say to them, that's a great multiple choice item. So again, sort of that open coding, reading transcripts line by line, really beginning to, identify the concepts you're seeing. Axial, so what you're doing is moving from the very close reading of line by line to getting a little bit more, what's the word? Abstract, is that the right word? A little higher up. So axial coding, beginning to organize those concepts, make them a little bit more abstract, selective, then really focusing on, well, what's your theory going to be, right? What is that final theory? One of the ones I came across in my reading, and if you're doing grounded theory work, I'm sure April is going to have some references, but I actually would recommend a particular example. It's about engaging with inherited risk for colon cancer. It was done by a genetic counselor in the UK. Who went on to do her PhD. And she did come up with this theory of engagement. And it really does jive well with all of the work I've done. When I look at that theory of engagement, this idea of some people are not very engaged with their risks, some are much more engaged, that can change over the course of one's lifetime. And all of the different sort of modifiers and confounds, those variables that came out of her qualitative data that impact that engagement really has held true in all of my work, I have to say. And I just found the article really useful. It was a quick read and useful. So if you have an interest in that, by all means, let me know. And so again, this idea of saturation we talked about earlier, of continuing to collect data until no new ideas or concepts are coming out of your data, that actually originated from grounded theory, by the way, this idea of theoretical saturation. Okay, so those are three. Again, I know I did that quickly, but again, remember, there literally are shelves upon shelves of books on each one of these, okay? I just wanted to say a little bit more detail on them. How do you choose the approach? I mean, look, like everything else, it just depends on your research question, first of all. But I think practicalities also play a role. Time, money, human resources. When you're doing some of these ethnographies, for example, they're very time consuming. I think some of the grounded theory studies are really quite time consuming as well to do them well. And personal preference plays a role as well. So I'll never do an ethnography because I just don't have time, for example, right? And I think that's okay. I think it's a matter of thinking carefully on your question, the practicalities, and your own preference, of course. All right, so I'm going to move on to talk a little bit about methods. Again, just a couple of slides on each one of these, because I actually want to show you a little bit of data. I'd like to have your input. Any questions before I jump on to methods? Is that okay so far? Is a bit of an overview? Making sense? Good, excellent. Thank you, Lucy. Great. Okay, perfect. So I think interviews are probably the most common, I think. Often they are semi-structured interviews with sort of open-ended questions. Probably the most common in qualitative research. It's certainly what I have used most often. And I really like it because it gives you the opportunity as the interviewer to clarify. So if a participant has said something and I don't quite understand it, it gives me the chance to say, I just want to go back to that and make sure I understand that. Can you say a bit more about that? And people are generally happy to do that. It gives you the freedom to probe other issues, and participants themselves will often raise other issues. And you have the freedom to do that, to say, oh, that's a really interesting point. Let's talk about that a little more. What I have found is that you will have an interview guide. You'll generally have your, whatever it is, half a dozen, 7, 8, 9 questions, things you really want to hit on and find out. But you may not ask each question in exactly the same order to everybody. It's why we call them semi-structured. And I'll tell you why that happens. Sometimes it happens just by how participants talk. So when I interview people about inherited conditions, and I've done a lot of that now, it's just an area of interest of mine, I always say to them, whatever it is. So if it's about a breast cancer, an ovarian cancer, a colon cancer, the Huntington's, newborn screening, whatever it's about, I'll often start with that kind of an open question. So, tell me a little bit about how you came to know you were at risk, right? I want to find out a little bit. And right away, people will often answer my next few questions, which might be, well, what did you do when you first found out you were at risk? Did you know you could have genetic testing? Did you go ahead and have it? That's often the order of my questions, but people in their response to that very first question, when I say, tell me a little bit about, the family history of cancer, or tell me a little bit about when you found out you were at risk, they'll often answer the next few questions I have anyway. So the issues will be addressed, but not necessarily in the same order. And that's okay. Or the exact wording, because I think it's important to have a conversation with people as well, right? Look, to my knowledge, there's no specific number to be conducted, really. Often, as I said, the rule is this idea of saturation. Either when no new ideas emerge, you stop, or I always do 2 or 3 extra interviews personally, just to make sure that I'm not missing anything. In my experience, when I have 20 interviews, I think across all of my studies, I don't think I've ever needed more than 20, to be honest. That's generally my rule of thumb, about 20. Recognizing that if I have missed a perspective, and so for example, often when I do interviews, I will get a lot of people from St. John's because that's where I'm situated. That's the main study site. So we get a lot of people from St. John's. So I might have 20 interviews from St. John's. I will continue to recruit rural Newfoundland, for example, because you want to hear from people, depending on what your question is, right? So for me, it's sometimes that, or maybe I'm doing an interview study about different genetic conditions. So maybe I have 10 or 15 interviews with whatever, Lynch syndrome, but I have no one from whatever, condition Y. So then I will go beyond that number, okay? So it's often that idea of saturation, like when are you missing new ideas or not? And we generally do record these and transcribe them verbatim. That's the usual thing with interviews. Kathy Charmes, by the way, writes beautifully about qualitative interviews. So anytime you see her work, Kathy Charmes is really, really good. Now, focus groups. This is another method, which I've also used. These can be very useful for a variety of reasons. Sometimes when group interactions might be useful, might allow greater insights to be developed. I was once involved years ago now with a team from University of Toronto. They were doing interviews with patients who had psoriatic arthritis. And they were talking about a lot of different, not just the impact on patients' lives, but very much about management and clinical management, how they were being treated. And they had chosen to do focus groups. I was invited in to help them analyze and run the groups and so on. But it was really useful. So these were a group of 5 or 6 people with a very particular condition. Some of them were taking biologics, again, a very specific condition. And so those group interactions, as they spoke together about their condition, about the treatment, I think was more useful than had you interviewed them separately. I don't think you would have gotten the same richness of detail. But focus groups, quite frankly, are also very useful when you only have a small sample to begin with, or resources may not permit more than a small number of interviews. And that matters sometimes. I know we talk about scientific rigor, methodological rigor, that's all very important, but practicalities and feasibility matter too. And I'll give you an example. So I'm going to show you some data from work we did here in Newfoundland and Labrador about breast cancer surgical treatment decisions. We went to Labrador. It was a very small grant, $40,000. We had just had a couple of years to do it. We did go to Labrador. And we did go to the west coast of the island as well, Cornerbrook, Deer Lake area. And we did hold focus groups because it allowed us to allow more women to participate in just those couple of nights that we could afford to be there, right? So we went to Labrador, we were in Happy Valley Goose Bay. We did a focus group discussion. So any of the ladies from Happy Valley came, and 3 or 4 of them came and sat with us in the room. But because we did a group session, we teleconferenced in, someone from Cartwright, someone from Maine, and someone from Lab City. And that discussion worked really, really well. So sometimes it's about feasibility as well. But always useful when people share that common denominator, whatever it is. So in my case, it was ladies who had had breast cancer. Maybe they're all members of the same profession, like the psoriatic arthritis patients receiving similar treatment, etc. So group discussions can be really useful as well. You generally have no more than 8 people per group. That might even be a little high, to be honest. 6 is a really good number. I think the literature will tell you 6 to 8. I have found, depending on how much people want to talk, 8 can be a lot. We did some of those focus groups with 8, and it was really challenging just to get all of the information, to get all the questions. But you're generally running several groups in one project, and skilled moderators really can be useful because you really have to make sure the discussion stays on track and that everyone gets a chance to contribute, right? Because you'll have some people who are more quiet and may need to be drawn in, and some who are like me and like to talk a lot and can easily dominate. Okay, final method I'll talk about, observation. Often, it can be of other people or the environment, almost always used, as I said, in the anthropological type research, ethnography research, but it also can provide a useful background information on the environment where a project is being undertaken. So for example, if you were doing some sort of a health needs assessment, key features of an area could be observed, right? Like describing the percentage of urban versus rural, or geographical features, or the amount of green space, or the number of grocery stores in an area, okay? The other thing I'll say is this, that I never used to think about, because I talk about transcripts a lot, of course, because that's what I work with all the time. But so, as I said, in the ethnographies, you're actually observing the scene or the culture, taking very detailed field notes. But maybe part of the qualitative analysis or method might be you're collecting documentation, policy statements, mission statements, annual reports, and there's some analysis being done on that. So that is your data. And I'll tell you where I've seen that a little bit in my area of genetics is I have seen content analyses of informed consent documents, for example, for genetic testing, where they collect a pile of these informed consent documents from different genetics clinics, and they go through them to pull out the themes, the things that are being talked about in those informed consent documents, for example. So I keep saying transcripts, but sometimes it can be documentation as well. Okay, let's move into the last part of this now. And I'll try to just do this, and still have some time for questions. Talk a little bit about analysis. In my experience, you just have to dig into this and do it. There's really no easy way to learn or to read a book that will tell you exactly how to do it, though I do have some ideas and some good references that I will give you. But let's talk a little bit about it, and then let's look at 2 or 3 slides of data. And I want you to code it and put it in the chat, or think about it at least, okay? So what do? We start by labeling every item of information. So you're reading through, so I use the word transcript because that's mostly what we're working with, I think. And you want to do that because you want to be able to compare the transcripts, right? To know, well, okay, what were the codes, the ideas that arose in my first transcript? Okay, do I see that in my second one? And we call it content analysis. It's just the basic procedure that's used. It can be at a descriptive level. So you're not really trying to be assuming anything about it or being overly interpretive, but it can also be at a higher interpretive level, right? Really concerned with what is meant by the responses, what is inferred or implied. And again, whether you're being purely descriptive or being a bit more interpretive depends on your research question, right? Of course, so it's okay. Either is okay. It just depends on what your question is. But as a broad sort of plan, I would say to begin to read and reread your transcripts as a group. You've got to start with that first one. Remember, we said right at the beginning of this that you're really going to spend time with each one. See what I have here? This is how old school I am. Students always laugh at me. Make a note in the margin. I still love paper transcripts. I've got to be honest. It's my absolute favorite thing. I still love them. I sit up with them. I mark on them. So I had to add in, or put it in your word processor if you're using a qualitative analysis package, which is totally fine as well. And I've done that as well when I've been a part of bigger teams where we had people in different provinces working on the same transcript, right? But I still love paper transcripts, I have to say. So you're literally taking your first one, spending time reading it, jotting down whatever comes to mind, something interesting, relevant, an idea comes to your mind, jot it down. At the end of that, think about, look at your notes. What kind of ideas are you coming up with? Make a list of that different sort of types of information that you found. I definitely recommend doing this for the first couple of transcripts, particularly if you're new to it, because it really does allow you to have a good close reading and understanding of what you're seeing, right? So you've got that list now. Think about these items. Can you categorize it in a way that describes what it's about? So for example, Dina, that's an excellent question. Content analysis and thematic analysis. I get it. I've got to be honest with you. I also struggle with that question, with what the difference is. And I've reached a point where I don't worry about it, to be quite honest. At the end of the day, the content analysis itself, I think, is just a way to say, we're going to analyze all of the content of this sort of transcript or document, whatever it is, and I'm going to do this slowly in a very systematic way. The thematic analysis, you can read, there's a great article by Braun and Clark, I think, about thematic analysis, which is great. To me, I just think about the thematic analysis as being somewhat higher order. So for example, let's say that I am reading my transcript line to line, and I see a lot of emotions. So in my work, I'm often talking about difficult disorders, difficult treatments, painful treatments, these genetic conditions, some of which are fatal. So you'll often find if I'm going down through my transcript, my first reading, I'll often write stuff like worried about children, right? People are worried about their children. They now have this risk, or they may, so worry, sadness at, whatever, at the prophylactic surgeries, for example, that many women have had to have because of these inherited breast cancer mutations. So sadness. I might have down, hopelessness for the future, for getting back. So I would call that content analysis, high sort of level, or sorry, not high level, specifically, right? Sadness, hopelessness, depression. But a thematic analysis, I might think about, well, what is that key theme? It's an overriding theme, isn't it? This emotional response to genetic risk, which is, to me, it's pulling together some of the more tangible codes. That's how I think of it, Dina. Am I perfectly right? I'm not sure, but that's certainly how I think about it. And I hope that helps a little bit at least. So I think of the thematic analysis as you really are thinking about what are the themes, as opposed to what are just some of the very specific codes you're starting off with. And when you do this, you're really starting with at that first reading, trying to look at as much, get in as many of those little codes as you can. Then when you go back and reflect on them, you're thinking about, well, are some of these major sort of categories, major themes? And I think the idea of, say, that emotional kind of response versus the specific emotions is a bit of an example of that. And you're doing that with every transcript. So you're going one at a time. So once you've sorted through all of those categories, you're trying to figure out, okay, are all of my items, are they in the right categories? Do they fit together well? Is there a major theme? And the emotional response, by the way, is one. It's much easier to sort of draw conclusions once you have all the data reviewed and coded. It's really hard to say to yourself, oh, am I right? I don't know. You really kind of got to get to the end of your transcripts. And yeah, I mean, that's how I think about it. I really do think about the thematic analysis for me is a little bigger picture. Yeah, a little broader. That's how I think about it. But I do have a good article I would recommend on thematic analysis, by the way, which I haven't read myself in a while. So I'm happy to share that if you email me. Email me directly. I'll definitely send that off. But that is how I think about it for sure. Let's just have let's try to take 5 minutes. Do we still have 5 minutes? I think we do. And let me show you a little bit of data, okay? And I want you all to just think about what comes to your mind. So let's think about the content analysis being really picky, line by line, okay? What comes to your mind? And I invite you all, flick stuff in the chat as it comes to your mind. Feel free to do that, and then we'll try to have a couple of minutes to talk about it. So this is from, as I said, the influence on surgical treatment decisions in breast cancer. This study came about, by the way, years ago, 2015, because we saw an article out of Dalhousie, investigators in Dalhousie, 1 year's worth of data that showed Newfoundland women had the highest rates of mastectomy across the country, even for early stage, sorry, forgive me, we didn't know about stage, very high rates of mastectomy, 69%, and the national average was 38. A friend of mine who had just had breast cancer, of course, this article caught her eye, and she said, well, what's going on here? Why do we have such high numbers, okay? So notice that we weren't one bit philosophical. We wanted to know, why are women choosing mastectomy? And are they choosing it because they're being diagnosed at a later stage? Maybe they have no choice. Maybe lumpectomy, it won't work. Maybe. So we, to Chris's point earlier, we did get quantitative data, and we did do focus groups around the island, Newfoundland and Labrador. And I want to show you some just here right now. This is the same lady. So have a look. She says, for my first diagnosis, I made my decision based on my own feelings, which were confirmed by those of my surgeon. Body image and my role as a woman were the most important factors in my decision. I didn't need a whole lot of time and I was quite comfortable with it. But then she says, for the second diagnosis, just 6 months later, I was so tormented. I didn't know what to do. I still didn't want to look down and see nothing, but I couldn't have reconstruction. I had just finished radiation for the first cancer. After much research, discussion with family and friends, and at this point, I was in this wonderful world of the Sharing Our Strength breast cancer support group, plus discussions with my plastic surgeon and family doctor, I made the decision to go with another partial mastectomy. So this lady did not choose full mastectomy. Okay, she was one of the few, by the way. Most women in our study did choose mastectomy, 3/4 of them. But again, have a think about what comes to your mind when you look at this and throw it in the chat. I'll tell you what comes to my mind as just quickly as I look at it. Right here, when she says body image and my role as a woman were the most important factors, I actually would write here body image. There's a big literature on that, by the way, as well. So that is all I would write there, body image, right? You know, second, now this one here, I was so tormented, right? I didn't know what to do, you know. I didn't want to look down and see nothing. So again, I would write body image next to that. So she's clearly thinking about that, right? Look this here, after much research, discussion, a breast cancer support group. The other thing I would write here, yeah, exactly, communication, support. I would write here, complex. So do you see how there's not one factor? She talks about a bunch of stuff, doesn't she, right? You know, lack of information. Sure, she says, I just didn't know what to do. And again, I was so tormented. I mean, tormented, that's a big word, right? She didn't say I was sad. Sure, I was tormented. So I might also write, you know, emotional reaction. Let's say this was my first read. Okay, hang on, let me go to another slide. I want to show you some more. So that was one lady, all from the same group of data, okay? Stress, 100%. Look at this one here. I think I was in a bit of a different situation. I knew so much. This lady was a nurse, okay, by profession. I might have even said, yeah, I know survival is the same. And she's right, objectively, lumpectomy and mastectomy at an early stage, the survival rates are the same. So she's absolutely right. And she says, you know, I might have said, yeah. And he said, yes, you're right. And I know he did say, well, what do you want to do? I said mastectomy, right? And he did say, you know, I think you're making the right choice. So I was kind of telling him because I knew what to say. I knew what I wanted. And then I asked her, and that was because of your family history. Do you feel that's what drove the decision for you? And what you don't know, because you haven't seen all the transcript, is prior to this, she has a very strong family history of breast cancer, okay? And she says, I honestly can't say. At that time, your anxiety is so high. I don't know what was right. You're just going through the emotions. So doesn't that get back to some of the things you just typed in there earlier? So she certainly has information. She's absolutely correct when she says, you know, survival is the same. She's not wrong. She's absolutely right. And yet she says, I don't know, I was feeling so many emotions, right? So you can see a time of high emotion in decision-making, right? So by the way, from a content analysis point of view, you're right, I agree, feelings, emotions, I would code it the same. But thematically, I'm already thinking, ooh, wait, how do people make decisions? The process of decision making. Here, this one is very much seems to be driven by emotion, right? So that might be a higher order theme that I may or may not come to later. Chris, that is very common, by the way. We heard that a lot, women choosing to have prophylactic, have their other breasts removed as well because of their strong history. Okay, last one. I just want to get through this one. Look at this here now. Same discussion. Okay, same focus group, just different people. Well, first of all, I was 54. I knew I wasn't going to have any more kids. I have 2 daughters and just the family history. Like I have 2 first cousins who passed away with breast cancer. My sister's 65. She was diagnosed at 57. Another lady, I chose a lumpectomy first, but I had a friend who was doing radiology at the time. I went home and she names her. I went home to her friend. She was silent. I think she knew from the lumpectomy results it was probably a later stage cancer. So I was doing research and she names her friend again. She did talk to someone. I can't remember who it was, an oncologist out there whose wife had breast cancer, who said to her, absolutely, I will go aggressive if that's your friend's result. And that was my final thing that pushed it. So again, 2 different ladies, and have a look here. So you can see again, right, age or stage of life, right, appear. So I would write age here, or maybe stage of life. Strong family history, I would write up here, right? Age, stage, yeah, exactly. And here, very much influenced by her friend and the information her friend received. Now, I'll tell you something. I would code that in a way that maybe you would not. I would code that as experiential knowledge. And I would do that because I have knowledge of that particular theory that we are influenced. And by the way, the ladies in this study spoke very strongly about their decisions being driven by the stories of friends and family members. That's very common in Newfoundland, by the way. So I want to make just a couple of final points because I know I'm rapidly running out of time. Thank you, everyone, for throwing your ideas in the chat. That's awesome. I love that. So I hope that was helpful, just to even just see a couple of slides of data. But do you see how, with just that little bit of data, first of all, it really is possible, isn't it, to come up with ideas, jot them down, right, on the side. You would do that for every single transcript. As you're doing that, you're beginning to see bigger themes emerge. But do you also see how, if you were to say, well, Holly, which is right, you can't say that right now because you don't have enough data, right? Would you agree? Not really enough data, right? And approval from family and friends is hugely important for sure. So I'm going to stop there, everyone, just to say that this really does have a unique role in health research. It really does offer insights into that lived experience of people. And I think that really matters. That can really matter in medicine and in healthcare. So again, I'm a big fan of qualitative research, and I hope you guys will join us for the rest of our sessions this month. I know Amy has a couple of things she needs to say before we end, but any comments or questions before I stop? Sorry, I've gone very close to one. I'm usually a little better. Apologies. But I hope that was helpful too, and to get to see a little bit of data as well. And thanks for all of your participation. Appreciate it. Excellent. And feel free to email everyone if you have any follow-up questions or want a couple of references. I don't mind doing that. I'll put my email address in here again, Amy. All right, thanks everyone. And I'll put it back to you, Amy.
Thanks, Holly. That was a very informative session and engaging. I just wanted to let everyone know about our upcoming sessions. So I'm just going to share my screen. So we have a few more sessions coming up in March. So we got High on Friday with an introduction to health economic evaluation. And the 15th, we have Rebecca, and that's the getting at the so what, the grounded theory and action with Dr. Holly. Oh, sorry, that's Dr. April Pike on the 22nd, and critical appraisal of qualitative research with Dr. Karen Parsons on the 29th. You can check out these events on our Eventbrite page to register, and you can also check out past events, and you can also see this recording of Dr. Etchegary's session today. I don't know if everyone's aware.
Can I ask a quick question? What's health economic evaluation? Just quickly, what does that mean?
That's a very good question.
I have no idea what that means.
Yeah, I think High normally talks about just like how do we demonstrate value in the sort of health system, like what does it look like if we're trying to say, well, here's a new program or a new service or an old program or new service. How do we evaluate it from a health economics perspective? That's as much as I know. Chris, I've never had the chance to listen to Highs. I can never make them.
Yeah, okay, thanks. Yeah.
Okay, and just want to let everybody know about our free training program. So it's open to anybody. There are monthly webinars. If you complete 6 sessions with at least one in person, you will receive a letter of completion. Now, obviously, in the last year and a half, these have been virtual sessions. But again, the registration for this is also online at the link below. And if you have any questions at all, feel free to reach out to me via email, or you can email the NL support as well.
Does this session count towards getting a completion certificate?
Yes.
Yep.
So, and you'd have to record it somehow, or?
Oh, no, we have a list of all the attendees, so we'll know that you completed it.
Yeah.
Okay, good. Thank you.
And Amy, just before we sign off, can you go back like just a couple of slides? I think someone had asked about maybe where you, is this the one, Asma, the one you were looking for about the different sessions that were coming up? Just maybe leave it there for a sec.
Yeah, no, before that, the one
Oh,
before
before
this.
that, before that.
Oh, there wasn't anything before that.
Oh,
Oh.
okay. I haven't saved
So
them.
these are
Thank
all
you.
on the NL support Eventbrite page, and I can also send, if you want to leave your email, I can send them directly to you.
Yeah, there we go. Yeah, and it's fine. It's
useful.
Pardon?
sorry, I didn't mean to cut you off. I just want to say it's fine as well if anyone wants to email me directly, and it's up there again in the chat, my email. I'm happy to send you the slides directly, but the slides usually are posted with the recording
Yes.
on Newfoundland Support's web page, but the slides themselves, I'm happy to shoot them off to anyone who wants them. So feel free to send me off an email.
Thank you.
Great.
Okay.
Thanks.
So any last questions? No? Okay.
That's
Okay,
great.
thanks again to everyone for joining us, and thank you to Holly.
No problem.
If you have any questions, like I said, feel free to reach out to me.
Thanks, everyone. Thanks, Amy.
Thanks.
Bye, all.
Bye.